3:34 to 26 more minutes here on the East Coast. Live look at the Dow. 26 more minutes of trading until we close out a week that we will remember for some time. Stocks sinking over the coronavirus fears. The White House putting together a task force to lead the response. Secy Azar is the Secretary of Health and Human Services from the North Lawn. He chairs the task force and is with me now. Sir, thank you for your time and good afternoon to you.
Great to be with you, Bill. Thank you.
I've got a number of questions. Let's see how much we can get through now. The word a moment ago was that the number of cases in the U.S. is now 63, which seems to be higher than the 61 previously reported. Is that the case?
So what we have are 15 announced cases from people who are not repatriated to the country. These are Americans who had been in Wuhan, the epicenter, and that's 12 people, as well as 2 spouses of those people who got it. And then the one case that was announced on Wednesday, which, as you've been talking about, is a suspected possible community transmission case because we don't yet know how she contracted it. We're fully deployed out in California to do the epidemiology, to try to figure out what happened.
Okay,
all the other cases were repatriated from Wuhan or the Diamond Princess. We brought them into the country.
Okay, let me come back to this patient in California a moment. Let me just see how much more news I can get through here now. What do you watch as we approach the weekend, sir?
We're just continuing our efforts to ensure that we've got testing out there. We're going to be announcing very soon expanded testing capabilities in the United States, flexibility from the FDA that will allow more labs to do testing. And then we're continuing to do the epidemiological research on this 15th case out in California to get to the bottom of how she contracted it.
Okay, what about a travel ban? Will that be extended to other countries? Yes or no?
Well, we continue to look at that. We've got travel advisories that we work on. We've got to many countries travel advisories warning Americans about risks of travel. The only country that we have travel restrictions with regard to right now is travel within China within the previous 14 days. But we are, across the whole government, constantly assessing countries and determining whether we should elevate either travel restrictions or travel advisories. But we've not made any additional travel restrictions yet.
What is the proper dollar amount as you negotiate with Congress? Is it $2 billion or is it $8 billion?
We have been very clear. We requested $2.5 billion as needs over the next 7 months for the 2020 fiscal year. But the president's been very clear. We're going to work bipartisan, collaboratively with Congress to get the right amount of money that they feel that we need to do the job right. We're not going to let money be a barrier to the preparedness and response of this country.
But if you need more than $2.5 billion, go higher?
We will spend the money if they're willing to give over $2.5 billion. We have programs we could spend on. We think 2.5 is the right amount, but we are very flexible. The president was very clear that we are going to work with Congress, the leadership. We're already in touch with bipartisan leadership, and we want to secure this within the next 2 weeks. We need to get that money appropriated so we can get advancing on our preparedness.
When you think about South Korea and Japan, these are countries that have modern medical programs in place. And when you see the cases unfolding in South Korea and Japan the way they have in the past week, does that give you greater concern that this could come here at a more higher rate, do you believe?
Well, Bill, we've always said, from day one, we've said that we will see more cases here in the United States, that's our expectation. But because of the very aggressive containment measures that President Trump put in place, really unprecedented measures, we have bought ourselves significant amounts of time here to continue our preparedness and to be on guard, and so that we can take what are called mitigation steps in the event we do see what's called community transmission, which is basically unexplained transmission from person to person. We're working to ensure that we're fully prepared for that. We've got the best public health system in the world.
Okay, that leads us back to this patient in California that you just described, a woman there. She's from the same county where Travis Air Base is located. Travis is the area where all those Americans were flown back from that cruise ship in Japan. Does it not seem likely or even possible or probable that she came into contact in that community with someone who returned home?
So we don't believe that's the case, but we need to be open-minded about that until we get all the evidence and the data, because we have to get to the bottom of this. We had individuals come back repatriated from Wuhan to that airbase, but none of those individuals had the disease. This woman presented with symptoms, had symptoms after that period, but before the individuals came back from the Diamond Princess. So it does not appear connected, but we must remain open-minded, and we just have to let the evidence, the science, the facts take us where it takes us.
Okay, that's an important clarification. What about the CDC and these testing kits? Are they on the verge of releasing more in a more efficient manner, I would say, Mr. Secretary?
Absolutely. That's a #1 priority for us with CDC, is to get more of these testing kits out there. And so we've got over 1,000 going to California right now. We're getting them out into the country. On Wednesday night, we approved a more streamlined test that allowed 40 labs to be able to do that testing. And we will very soon be announcing guidance from the FDA that allows private labs to develop their own test very quickly. So we will have adequate testing capacity out there in the United States.
So the effect of that would be a more efficient test, correct?
Absolutely, a more efficient test and in more locations.
Okay. Democrats say you're downplaying this. How do you defend that?
Well, first, I think it's very important that we not make this a political issue. This is a time, as the president said, that we all need to be standing together and working together. It's not a time to be scoring political points. We have been very transparent from day one that the risk to Americans at the present time is low, that could change rapidly, and that we must be prepared. That's been our message throughout, and that we think we'll see more cases here in the United States. We're not downplaying.
Okay.
We're trying to be.
So
we think the American people can be leveled with.
Have you considered a daily press conference or statement that would be slated for a certain hour of the day where you can inform more people at the same time, and do that every day, Mr. Secretary?
So we have been doing that. So the CDC provides a telephonic briefing at least 3 times a week. I'm on TV almost every single day. Tony Fauci, other key thought leaders are on TV almost every single day. We've had press conferences quite frequently. We also don't want to. We want to give transparent, immediate information. We answer the questions. I just spent an hour sitting with the White House press corps to answer all of their questions. So we want to be transparent, but we also don't want to hyperventilate, because for the average American, nothing has changed in their life. Your government, are taking this seriously. We are working with Congress. We are preparing across the federal, state, and local levels. But for the everyday American, the risk to them is low, and it does not result in a change in their daily lifestyle right now. But that can change, and we want to make sure we're transparent about that.
So right now, no press briefing scheduled on a daily basis, but you mentioned the CDC telephonic call. On this whistleblower out of California, what happened there?
So we don't know yet. So after you showed a clip of me at a hearing where I was asked about information apparently from that whistleblower's complaint. I didn't learn of that complaint until later that night. I have ordered an immediate full investigation. What matters to us? First, our employees must be protected. Second, they must follow all isolation and quarantine protocols. Third, we must have a full investigation to learn if there's any truth to these allegations. And fourth, we will never tolerate any form of retaliation against a whistleblower.
Sir, thank you for your time. I know you're busy, but I appreciate you taking a few moments here. As you know, there is a lot of concern all across the country and the world, for that matter. Sir, thank you. Alex Azar.
Thank you,
from the North Lawn.